Dr. Philip E. Stieg, professor and chairman of the Department of Neurological Surgery at Weill Cornell Medicine, New York Presbyterian Hospital, and the Weill Cornell Brain and Spine Center. You're listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Philip Stieg, Chair of Neurosurgery at Weill Cornell Medical College and Neurosurgeon-in-Chief at New York Presbyterian Hospital. He has developed an international reputation in the area of cerebral vascular disorders and skull-based surgery and is considered one of the top neurosurgeons in the world for aneurysms, AVMs, and other cerebral vascular conditions. Dr. Stieg has been active in many international courses and been broadly published. He has contributed to groups such as the joint sections of the cerebral vascular surgery of the American Association of Neurological Surgeons and Congress of Neurological Surgeons, where he now assists in the capacity of past chairman. In addition, he is the past president of the Society of University Neurosurgery. He's also the host of the weekly podcast, This Is Your Brain with Dr. Philip Stieg, which provides fascinating conversations with medical experts and patients about the wonders of the brain. Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Philip Stieg, Weill Cornell Chair of Neurosurgery. Doc, how are we doing today?
Just fantastic.
So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
It's interesting. When I first went into neurosurgery, I thought that I was going to become a pediatric neurosurgeon, and I trained at an institution that was notable for being vascular neurosurgeons. And I actually had a fellowship lined up in Toronto, which at that time and currently is still probably one of the premier pediatric neurosurgery fellowships. And in my last year as a resident, I realized that I loved vascular neurosurgery and actually had a facility for it. I also realized that some of the personality traits that were required to be a pediatric neurosurgeon, I didn't particularly relish having to develop to a higher level. So I changed my mind during my residency, which is, I think, quite common and appropriate. My goal during residency was to be trained as best as I could from a clinical and technical standpoint, but I always had aspirations, having acquired a PhD before I went to medical school. My aspirations were to become an academic neurosurgeon.
So kind of going through your fellowship year, can you kind of take us through your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
I didn't really have to do a fellowship year. I did a year of research at the Karolinska Institute looking at restorative and regenerative neurosurgical procedures with the long-term hope, which I've actually gotten back into, with cell-based therapies in the treatment of stroke and other CNS abnormalities. But during that time, again, I was trying to lay the groundwork for being a sound entry-level academic neurosurgeon. With the founding of both what I considered a strong basic science background and also a superb clinical training, I felt that I was very well positioned for getting into the market. Getting into the academic market is very different than getting into the private practice market. I'll speak briefly about the private practice market, although I don't have considerable experience with that beyond the fact that I've mentored and coached some of my residents in that area. In the private practice market, you're looking again for being able to develop a niche within a group. You're looking for a group that doesn't have a history for hiring young, cheap surgeons and then dumping them at 2 or 3 years when they want to become a partner. So you want an honest group with integrity. You want a group that's has a track record for developing younger neurosurgeons and keeping them on as senior partners. You certainly want to be in an area, I would think, from a lifestyle standpoint, where you're not covering 20 hospitals, running around between emergency rooms, making your life miserable. But rather, you would like to be in a community where you have one major hub hospital. You might have to cover an ancillary hospital from a referral standpoint, but the major surgery is going to come to you. Being in private practice neurosurgery is certainly about being a good neurosurgeon, but it's also a lot about the lifestyle. Where do you want to live? How do you want to spend time with your family? In terms of being prepared for academia, which I felt I was, I had a job offer at UCLA and I had a job offer at Harvard. and I picked what I thought was best for me. I thought Los Angeles, there was a little bit too much downtime enticement, and I felt that I'd get more work done in Boston. Hence, I chose the job in Boston. And once I did that, then I started planning how I was going to approach the early parts of my career.
So can you kind of take us through what some of the keys to your success that shaped your early career as you climbed the top of your industry?
I think this is true both in private practice and also in academia. When you're starting in your career, the answer is yes. How high can I jump? How fast can I be there? It is the 3 A's: available, affable, and ability. So from a clinical side, that's what you have to do. I will say this, that developing a clinical practice, as long as you don't go into a saturated market, is not as hard as one would think. So for an academic neurosurgeon, if you're actually going to be doing research or clinical trials, you have the time to develop those and develop interest in those. If you don't spend the time, then you're going to end up just being a high volume surgeon in an academic setting, which is okay. You get to teach residents and teach fellows, but you're not going to rise up the academic ladder. So you have to have this appropriate balance. If you plan to rise up the academic ladder, you have to have the appropriate balance between doing things that are academic. So what does academic mean? You have to break it down into, teaching, research, clinical activity, and administrative activity. And in most institutions, in order to climb the academic ladder, you have to be strong in one of those, two of the four categories. Usually it's clinical work and academic work, or clinical work and teaching. And then the promotions committees will evaluate you on that. And as an assistant professor, you have a local reputation. As an associate professor, you develop a national reputation. And as a professor, you should have an international reputation. So as you start thinking about developing your career, say, okay, what's going to make me locally known? What's going to make me nationally known? So you get involved locally with your hospital, and you're doing outreach and volunteer work. To become known nationally, you publish your work, both either scientific or clinical, and you get involved with national associations. Predominantly in neurosurgery, it would be the Congress of Neurological Surgeons, which is for the younger age population. And then within that, you get involved in subsections based on your area of interest. So there's tumor areas, spine areas, cerebral vascular areas, stereotactic functional area. You interact with those people on a national basis, and then you get invited to give talks. You put on CME, continuing medical education courses. And then with that, you eventually develop an international reputation, and you get invited around the world. There are other things that you can do as well nowadays. As you know, there's globalization of world neurosurgery. We at Weill Cornell have an active program in Tanzania. We actually have a medical school in Tanzania and a second medical school in Qatar. And we're now starting a third program in Senegal. We have smaller programs in Mexico and in Antigua, but we very seriously take our role in the education of international neurosurgeons. So that's another way of enhancing your academic career.
What advice do you have for the graduating residents and fellows entering the professional job market for the first time?
When I'm interviewing somebody coming in for a job, one of my first smiling questions is, how much money does your wife want you to make? Clearly, you're not necessarily going to make as much money in academic neurosurgery. There are opportunities, but it isn't necessarily like going into private practice. And if that's important to you, you need to look in the mirror and accept that, okay? Because if you're always going to be striving to make more money and not do anything academic, it's a little bit hard to fit into the crowd. Now, there are, as you know, within neurosurgery subspecialties that are more lucrative: spine surgery, cerebral vascular surgery, and tumor surgery. Things that aren't lucrative are pediatrics and stereotactic functional and trauma. So, you can pick your career. Now, this is not to say that I don't know of any neurosurgeon that has a difficult lifestyle financially. It just really becomes a question of magnitude and how much you or your family want to make. Then I think the next thing, if you're making an academic decision, I think that you have to narrow it down to a city location that you'd like to live in, and then the best academic environment that you can be in. And to assess an academic environment, I think you need to understand who the chairman of the department is, how much support they're going to give you, how much independent time, how much time are they or one of the senior members of the department going to contribute to mentoring you, and how will they help you get involved at the national and international level. If you're looking at private practice, you want that senior partner that isn't slick and dishonest, but they look at you and say, okay, I'm going to help you develop your career. And in both areas, you have to have a niche. Okay, you can't just come in and say, I'm going to be a master of the universe. Number one, you're not prepared for that coming out of training. But number two, you want to start developing a referral base in a particular area. That doesn't mean that you're only going to do that, but it is, again, a way for you to develop the local, hopefully national and international reputation. In private practice, you just need a local reputation. But that kind of focus. And then the other thing to being successful is you need to be extremely disciplined about how you spend your time. One of my comments to most of my faculty and residents is, I'm not impressed if you substitute activity for accomplishment. All right. And by that, I mean, there are lots of people that I work with that are just busy all the time. And then if you look at what they've accomplished, you can't put it on a piece of paper. So really look at what you're doing and saying, okay, what's the substance to this? If there's no substance, you're probably wasting your time. If it makes you feel good, that's fine. But then don't expect to get credit for it. If you want to move up the ladder, you have to do things of substance that matter, that make a difference. And you methodically have to think about that. And I think that it's key. When I first started, I had two mentors that I worked with, Mike Scott and John Shillito, that were leaders in neurosurgery in their time. And they were always willing to sit with me and help guide me. And we would review cases. We would review the world of neurosurgery. I'm forever indebted to them, aside from my original mentors, Duke Sampson and Hunt Bacher. So even at my stage in my life, I have either a mentor or a professional coach that you can bounce things off to really make sure that you're thinking about things in a correct and clear way.
What are some of the biggest mistakes you see young surgeons making out of residency?
I think it's being overeager. I want to be the master of the universe and I want to try to do everything. Number one. Number two, it's I think a key component in everything in medicine, but certainly in neurosurgery, because neurosurgery is such a small field, that they don't spend enough time developing an emotional IQ. It is really exceedingly important. There's only 3,500 neurosurgeons in the United States, and everybody wants to take our cases. The orthopedic surgeons want to do the spine, the plastic surgeons want to do the peripheral nerve, endovascular, who are, other people will take away a lot of the cerebral vascular work that we do. So that leaves stereotactic, functional, pediatric, and even in the tumor world, people want to do a lot of radiation and other adjuvant kinds of therapies. So there's always people chipping away. Therefore, you can imagine that if you're not a person that somebody wants to be around, they're not going to refer cases to you. They're not going to come to you for opinions. So we as a subspecialty, but more importantly, at the individual level, you have to have a high emotional IQ so that people want to hang around with you. So that is probably the thing that was least talked about when I was coming into the field. And now, happily, it is being discussed more commonly.
Can you kind of talk about the creation of the surgical innovation labs?
Yeah, I mean, there are three things that I wanted to accomplish when I moved down from Harvard to Cornell, Weill Cornell. Number one, again, when I was starting, most neurosurgeons were iconoclastic and not not necessarily terribly friendly, and the concept of emotional IQ wasn't where it is today. So I really wanted to create a department of neurosurgery that was familial, and kind of, professional but family based. And this is probably best typified in a new book that just came out by Eric Schmidt about the $1 trillion coach, Bill Cunningham. I would recommend it to everybody. It really talks about how to structure a business and still not lose that sort of family sense of how you want to structure the business. So that I achieved. Then we wanted to achieve academic and clinical excellence, and we did that. And how do you do that? Given the fact that residents now, when I trained, we were working 120 hours a week. Now they can't work more than 80 hours a week. And part of it has to be in clinic, and part of it has to be in all this extracurricular stuff. So they're getting much less time in the operating room. So I recruited Dr. Antonio Bernardo to work with me, and we started the Surgical Innovations Lab, which allows residents and fellows from around the world to come and practice surgical approaches. And in addition to that, apply the newest technology in image guidance, artificial intelligence, and really kind of a fermenting ground for innovative approaches towards surgical procedures. And that also has been exceedingly successful.
Can you touch on your involvement with the NFL and the New York Giants?
Yeah, several years ago, there was a big kerfuffle about the concussion rate in the NFL and its presumed role in the development of chronic traumatic encephalopathy. And there was a lot of, hysterical behavior going around it. A lot of people were looking to achieve fame and that. And then the neurosurgeons got directly involved with the NFL and started the head and spine injury group. And a number of us around the country got involved with our local teams. And all I can say about it is we all know from boxing back in the 1930s that repetitive head trauma is bad, and it leads to what was called back then dementia pugilistica. Now it's being called chronic traumatic encephalopathy. And, is there a continuum between chronic traumatic encephalopathy and dementia? I mean, all of this is being worked out. We know that repetitive head trauma is bad. So the NFL, becoming enlightened, has started this head injury group, but also they've worked with helmets. They've worked with, us being on the sidelines, and working with the New York Giants has been superb. I will say that their team doctors and their training staff are really spot on in terms of if a player looks like they had head-to-head contact, and now we've got cameras in the sky, and we can replay it. If they've had head-to-head contact, we bring them to the sideline. If there's any indication that they've had some concussive injury, they get pulled from the game. And if they don't develop any symptoms, then they haven't had a concussion. If they do develop symptoms, then they go through a very strict protocol for getting back into playing.
Can you also talk about your podcast called This Is Your Brain?
That is a fun component. You may have noticed that there are a lot of individuals out there trying to claim that they are the thought leaders in the concept of brain health. And I was particularly bothered by that. There are some notable individuals that aren't even close to being a neurologist, a neurosurgeon, psychiatrist, or psychologist that are claiming that they know how to tell you how to approach appropriate brain health. And I was, as I said, bothered, offended by that. And I felt compelled that neurosurgery, I mean, let's face it, what do I do every day? I'm operating on somebody's brain, and I'm in the most intricate portions of their brain. I think I should be a strong proponent for what brain health is. And there's a common sense component of it, which is, the heart-friendly diet is a brain-friendly diet. There's, the sleep component of it, the emotional component, the hormonal component to it. And then there's proactive things that individuals can do. And I wanted to be a strong proponent for how individuals should lead healthy brain lives. And I felt that as a neurosurgeon, I had a bully pulpit upon which to do that. So, about 10 years ago, I had a brief stint with NPR on a radio show. And then I kind of missed it. And I went back to the radio people and said, nowadays it's not radio, it's podcasts. So I said, okay. And we started putting together this podcast, and I'm interviewing people, always about something that has a brain component associated with it, to the extent that I'm being a little bit frivolous, but I've interviewed social anthropologists that study sex and looking at the positive impact of sex on your brain health and your emotional IQ. So it's really been a broad spectrum podcast on how people should approach their lives so that they have a balanced, brain healthy life.
Where along your life did you get help as far as managing your business?
When I first started, obviously, I talked to some professional search firms just to get an idea of what the market was in terms of what should I expect in terms of private practice versus academia. And then, and it's not only the salary that one has to look at, it's the benefits, it's the, in private practice, it's the progression to becoming a full partner. Academia is a little bit more straightforward, you have a little bit more control over your life. And then, throughout life, I would always have friends that were either in law or in business, and it wasn't necessarily professional help, but I would have extensive dialogue with them about their business, and then we would talk about how that might apply to what I did. I think where the next major area was when I became chairman down at Weill, Cornell, New York Presbyterian. I had been there for 5 years, and I went to the president of the hospital and the dean, and I said, I'd like a 5-year annual review, which was not part of their armamentarium. It was, that's how backward it is from a business standpoint, or was back then. And they said, we'll get back to you. They never got back to me. So I went out and I interviewed 3 different consultants, and I said, I want you to do a 360. So what a 360 is for the non-initiated is this individual will go and interview people that work for you, people that are equal to you, and people that you report to. And they ask them pertinent questions about how effective you are as an individual in that given community. And it's all discreet so that nobody knows, and so they're willing to be extremely candid. And my consultant brought that back to me, and I was somewhat surprised at some of the feedback. But and a lot of the people that were my equals were saying, "Why the heck is Phil doing this? This is risky." That's because I wanted to be better, And as you know, in the business world, this is standard fare. I mean, every year, and I do an annual performance review with my faculty every year, and I want one every 5 years in my department, so that you can develop a blind eye to a problem. And that was extremely helpful. And through that, I've always been fascinated by reading Harvard Business Review books. Like there's Leading Change by John Kotter. It's like a Bible of 12 ways to change your environment in the business world. And there are the one other book that I referred to, The $1 Trillion Coach, and there are a number of other books that I've really read that are phenomenal. So there's lots of literature out there from the Harvard Business School that I just consumed, in addition to having that professional help. And I think that that's extremely important for somebody that wants to be a leader in whatever job or medical profession they choose.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.